do, but instead of working with us, they've spent months complaining about the Affordable Care Act because they don't get it, and guess what? They never have. For the last 15 years, they've taken every opportunity to criticize the Affordable Care Act and to talk about what they would do instead if they were in control. Well, the time is here, but their plan is not here. They have no plan, and they haven't put forth an alternative yet. That leads us to conclude that they do not have a plan. And if you look at the way that they've handled everything from health care to the economy and how they've made everything less affordable, it's not clear that they ever will. Even if they were capable of putting together a plan, it's becoming clear that Republicans just don't care. They're choosing to ignore the voices of the American people who are struggling to afford absolutely everything. Again, from food to housing to health care to goods to utilities. But the truth is that the people are not their concern. This isn't something that I say lightly, but we know that actions speak louder than words, and the Republicans' lack of action is deafening. It says they don't care, and they don't care enough to even do their jobs. Since they don't care enough to put together a plan, we've done the work and offered them a simple one. Extend the ACA tax credits for 3 years. That way, premiums don't skyrocket and overburden families across this nation. And while the extension is in place, well then let's work together to make health care more affordable and more accessible. This is the Republicans' latest chance to speak with their actions and show who they stand with. But no matter what they decide, we know where we stand. We are on the side of the American people. We're going to fight to lower costs and to make life better for families. And we're going to keep sharing our vision for a more affordable America.
Thank you, Senator. Also Brooks. Okay, we're ready for questions. Yes.
On this briefing that you're about to have with the national security leaders, how concerned are you about the possibility of a ground war in Venezuela, and what will you press the Secretary of Defense and others on in terms of what rationale they would have to take that step?
First, we're very concerned. You've heard Trump's musings, ministrations, contradictions on what he would do, and he's the president, and they all listen to him. So we are very, very concerned. To go into war, land war, in Venezuela is an act of war. That is Congress's right. And Senator Kaine and myself and 2 others, Schiff and Rand Paul, have the War Powers Act ready to be introduced on the floor of the Senate. We hope Republicans will join us in that vote.
Leader Schumer.
Yes.
Last week you told us that one of the reasons that there hadn't been meaningful negotiations is because Republicans hadn't put out their proposal. Now that that's out, do you see any path forward to find something in between these 2 proposals, or is it one or the other?
Their plan is a non-starter. They even know it themselves. They're so struggling that they couldn't come up with a real plan, that instead of the total embarrassment of having no plan, they have the total embarrassment of having a plan that's been rejected over and over again, that doesn't lower health care costs, that doesn't extend the ACA 1 day, which is what the American people are asking for, and has all these poison pill riders, such as abortion, which they know are killer amendments.
So is there any path to negotiation?
Next.
I was just going to ask you about
Look, negotiations, we're always willing to sit down and negotiate with someone who would lower costs. Their bill was absolutely not lower costs. It would raise costs for the American people. Yes,
I was just going to ask you about the Hyde language and stricter abortion limitations that Republicans are demanding as a price for any kind of ACA funding extension. Is it off the table for you? Does that mean there will be no extension?
Yes, off the table. They know it damn well, but because they can't come up with any real solution, and they're so, afraid of the Susan B. Anthony League, they put this non-starter language in. It shows they don't care about reducing health care costs. They care more about taking abortion away from the women of America than they care about reducing health care costs. Yes. Yeah, go ahead. Mr. Ronald Wyden, D. Oregon, would like to say a few words.
I just want to make mention of how they've handled this. They said their #1 priority at the outset of these negotiations was fighting fraud. We went out and put together legislation, black letter text, that said that there would be criminal penalties for fraudsters, but they totally ignored it. So they have never been serious. And if you're serious about health care, you've got to want to have criminal penalties for fighting fraud, and they ignored it.
Mr. Leader.
Okay,
Mr. Leader,
last question.
you called the Republican plan a non-starter. They said the same thing about your plan. Doesn't that mean that these tax credits are almost certain to expire at the end of the year?
Yeah, and the burden is on 13 Republicans to vote with us. Ours is the only plan. Their plan would allow the tax credits to expire, in your own words. Our plan would stop them from expiring. That's why it's supported overwhelmingly by the American people. Just remember, 55% of Trump voters, according to the data, support our plan. Thank you.
Why not a 1-year extension?